Hello everyone and welcome to the Mental Health Seminar. I'm Rachel, I'm the Deputy Head of Content at Pro Landscape magazine and I'm going to be your host. Thank you so much for tuning in. As you can see, there's a chat where you can enter questions. I'll do my best to sort of work them in as we go, but there'll be an opportunity to ask questions at the end as well, so we'll get round to them. Thank you, a huge thank you to all of my panellists for joining me for this seminar. I'm going to start off by having everyone just quickly introduce yourself, what you do, and what your company does. Should we start with Roger?
Yeah, hi, my name's Roger McGivern and I work for Green Tech. Green Tech supply into the landscaping industry and forestry industry. Anyone who knows the industry will know us. My role within the company is I'm one of 3 sales managers and I'm also one of 2 mental health first aiders. So today is a subject very close to my heart and something I'm actively involved with.
Perfect. Owen, did you want to go next?
To make sure I'm unmuted. So my name's Owen Byrom. I'm a mental health and landscape consultant and founder of Headplace, and we create happy, healthy places through research, design, assessment and consultancy of projects within the built environment, both internally and externally.
Brilliant. Katie?
Hello, my name's Katie. I am a director and co-founder of Studio 31. We are a landscape architecture practice with a focus on research-led design for health and sustainable, environmentally conscious design. And I am responsible for both of those aspects. I've got a background in mental health. I was a mental health practitioner and a lecturer on a mental health course at Essex University, which I do continue to do from time to time as well. So yeah, so that's us.
Fantastic. Helen?
I'm Helen Waddington. I'm the head of casework here at Perennial. So we're the only benevolent fund supporting the industry in the United Kingdom. So my role is I manage the casework team, and part of our remit is advice, support, and particularly during COVID, we've been working on mental health strategies, mental health support, and you'll hear a bit more about that later.
I'm just going to go to Kate because I know you work for Perennial as well.
Yes, my name is Kate Cooney. I'm Corporate Partnership Manager for Perennial, and at the moment we're working very closely with Helen and her team, talking to organisations about how we can support mental health and also how they can help support themselves as well. Thank you very much for having us here today. Our vision is that every person in horticulture knows about Perennial and the services that we can offer and feels comfortable contacting us. So thank you very much. It's lovely to be here.
You are more than welcome. Thank you for being here. And last but not least, Angelina.
Hi everybody, my name's Angelina Sooren. I'm the Health and Safety Director for Ground Control. So we maintain lots of external areas, providing landscaping, winter gritting, utility works, artworks. It's to name a few as well, I would say. Really delighted to be with everybody today. I mean, we're in the middle of our annual wellness campaign. People are at the centre of everything that we do as a business, and that's why I joined myself a year ago. I can see that our people are at the heart of the business, and it's so important to us. We've been campaigning mental health and wellbeing for a long time now. I know it was a bit of a taboo subject some time ago, but I've got to say our MD, our CEO, all of our senior management team really believe in looking after your health's your wealth at the end of the day. Mental health is really important, so I'm really excited to talk about all the great stuff that we're doing.
Fantastic. Yeah, we'll get onto lots of great questions today, I hope. I'm going to kick off just by getting Katie, Roger and Angelina, and the others might be able to weigh in as well, to talk about what mental health policies your company has in place, sort of when you implemented them and how easy that was for you to do. And should we just go around again in the same order? If we start with Roger.
Yeah, okay. I mean, from our point of view, it's obviously, Angelina mentioned the taboo subject and something which has been slow burner, I think, in terms of industry recognising the need for mental health. Something we started looking at back in 2018 when Rachael Kay and myself attended the mental health first aid courses local to us, and we've developed a policy which is continuing to develop now. So the things that we look for and the things that we try to do is to raise and create awareness throughout the business of what mental health is and what that means. People sometimes have a perception of mental health being a deep depression, and actually it isn't. It's just day-to-day stresses and how we deal with them, and the better we deal with them, the better impact it has on us. But from a business point of view, we want to try and open communication and support with all of the employees, make them aware of what, as a company, we can do to support them. And also there are, from a corporate point of view as well, things like compliance with law. We have to make sure that we are doing the right things for the right people. And as we become more and more aware of mental health and the impact it can have on people, we have a responsibility to make sure we're doing the right thing both by them and by the organisation. So I'd love to say it's a black and white thing, but it really isn't. And we're learning and developing and adjusting all the time, none more so than this year and all the challenges that's thrown at us. So really, yeah, that's. Does that answer your question? Do you need any more information?
Yeah, I think that's good. That's good. Katie.
Hi. I mean, we set up the practice. We're actually 4 years old today. It's our birthday.
Happy birthday!
Thanks. And when we set the practice up, because obviously of my background and my role, mental health specifically was always going to be a really core part of that. And we focus on our projects on like research-led design for health. So I was really interested to see that Owen was here today and really interested to talk to him. So we kind of have those values within our practice. So the way that we run our practice reflects kind of the projects that we work on and all of that. So obviously there's a heavy focus on the link between health and nature. And you know, most people watching this will know that the kind of positive impacts of nature on health. We have a rural office, first of all, so nature is literally on our doorstep. We look at some of the research around mental health at work, and there's lots of research that kind of says that nature, offices with views of nature, offices with plants. I mean, you can see, like, I mean, we've got a ridiculous amount of plants. I'm so glad I'm not responsible for watering them, because I would kill them all. So we've got, you know, all of those kinds of things. We encourage staff to kind of get up, get out. We have office yoga every week to connect everyone. So we kind of look at the value of exercise, moving your body, and kind of that connection and that teamwork. So we make sure that we have those built into the way that we work. So we have team yoga. When we have meetings, we try to have them outdoors if we can. We have a lot of walking meetings, or outdoors in rural cafes, those kinds of things. We like to empower our employees to have some control over some of the decisions in the business. And I think that that's really important to kind of feel a sense of ownership when you work for a practice. And we're lucky because we're small that we can facilitate that. We have a real open door policy. I think Roger's completely right. There's a huge amount of stigma connected to mental health. And obviously I've worked in mental health and really felt that. And I think the number one thing is kind of challenging that stigma. So the team here will literally be sick of me going on about mental health and how important it is. And I think just having those really open conversations makes a huge difference. We offer flexible working from home. We know that there's a lot to do with, you know, increases productivity, increases motivation, job retention, all of those things. It reduces stress at work to allow people to work flexibly. And we really advocate for like a work-life balance here. Again, Roger mentioned kind of having a mental health lead. We have a mental health lead here and a real open door policy. One of the things we really do is kind of advocate that a sick day isn't just physical health, it could be mental health as well. And I think that's something that companies find really hard to get their head around, because when it comes to it, how do you phone up and say, I'm having a sick day because I don't feel mentally well? And we kind of really advocate for that in the office as well. So there's just some of the things we do. But I mean, you can come back to more. I want to let the others talk as well.
Yeah, and it's great that you're here, because a lot of the time people say that they're a smaller business, they're not sure what to do, but you're kind of showing that there are stuff you can do even as a smaller company.
Yeah,
so that's great. Yeah. Angelina, did you want to?
Bear with my technology. Oh dear. So yes, well, I guess it starts from the beginning of our journey, really. We've got over 6,000 people across the portfolio, and if you look at the mix, very male dominated the environment of landscaping. As we all know, statistically there are some interesting facts around mental health, well-being and suicide rates amongst men in this field. And I suppose if we go back to the beginning, we've had a policy for a very long time, and as part of the onboarding process, everybody gets a handbook. It hasn't got to be complicated. So if you're, again, it's scalable. So if you are a smaller business, you can look at, you know, having a one-pager. It hasn't got to be chapter and verse, and there's no right and wrong in that sense. So I think it's just about making sure that you pitch to the right audience. And when you're on board, as we do, we undertake health assessments. Everybody's very much aware through their induction that there is a open door policy through every level. And I've had people contact me from departments, and I didn't even know the person. So it was wonderful that they felt that they had the ability to reach out. In terms of, I suppose, the other way that we interact would be our road shows. So I don't know if anybody's been to them before. We have a number of programs that run across the UK, and we invite all of our teams there, and we have campaigns that we have with all sorts of initiatives. It's just fantastic. We also have key speakers, so it may well be somebody that's battled with, say, substance abuse. Again, that's something. We're in unprecedented times at the moment. Substance abuse has been on the radar. Loneliness, COVID, stress, pressure of managing large and small businesses. So we've taken that into account when we're liaising and talking to our teams. So I don't want to go on about everything, because I've got some really good stuff to share with you, but it's about keeping in touch. It's about being accessible. It's about having mental health first aiders. We've got different levels of management and also personalities across the business, where we open that to everybody to get in touch. Your health, as I say, your mental health is your wealth as well. So I'm sure that there's a lot more on my list I want to run through with you, but I don't want to take up too much time.
Just quickly, for anybody watching who might not know what a mental health first aider is, could you just quickly give a description?
Yeah, so essentially we have a team. So we have team members across the business that have gone out and had some expert training in terms of the way in which they would manage a situation where, if somebody was in need, the parameters of which they can work. So again, it's just about finding the right environment, making themselves available. They also need to have support, because when you offload to a mental health and wellbeing advisor, quite often a lot of it's said in confidence, and that can be quite heavy for people to take, especially if they're getting it from multiple levels. So we also have in-house counsellors, so who support not only our wider group, but also our first aid mental health first aid aiders. So they will obviously look to understand whether there is a significant risk, and by that, are you going to harm yourself, anyone else, that sort of thing, that scale. Do you feel that you need medical assistance, or is it just at this moment a chat? How far are you through your journey? So is this and I'm sure there's lots of people on here today that were absolutely fine. In fact, maybe even said, oh, what's mental health? Oh, a bad day. Could have been that, or there could have been people on here that have gone, God, I've struggled with this for years and years, up and down. COVID pressures have highlighted that even the strongest out there can break. And it doesn't matter whether you're a male, female, where you're from, you know, where you're located across the business, it can affect anybody. So, you know, our mental health first aiders can reach right up to, you know, director level. So it's really important to understand that, I suppose, if you're identifying anyone to train, if you've not already done it, somebody who can be fairly resilient, because it is quite pressuring in that sense, that they've got the time to give. Because again, if it's part of the day job, where do you find the time? You have the right setting. Obviously, again, COVID's kind of squashed that, but again, it's about having that time. It might just be a coffee off-site somewhere. It could just be someone's living room because they don't feel well enough to walk outside the house. Obviously, COVID permitted social distancing considered, but there is an awful lot to mental health first aiders, and I absolutely salute you all for all of your efforts, because there will be people on this today, this conf call. You've saved a life through that without knowing.
Absolutely. Obviously, we all know that mental health affects everyone, but it is suicide is the biggest killer in men under the age of 45. How do we go about engaging men with their mental health and supporting them through it? And I'm going to put that to everybody. I'm sure everyone has something they can bring to that.
Yeah, I mean, just to pick up on that a little bit, I think it is a generational thing as well. And I am a mental health first aider within the business, and we ran an event in February, Time to Talk, where we did a presentation to the entire company, got bacon butties in, back in the day when we could all sit in the same room and sit next to each other. And it was just before COVID happened. We do have quite a number of younger people within the business, and I did notice actually as a result of that, the mental health first aiders were approached by quite a few younger people. And I think there is a generational difference between, fortunately, younger people coming through, and I class anyone less than 30 as younger. I'm that age now when I can do that. But they seem to be more responsive and more ready to acknowledge this than perhaps the older generation. And so it's people of my age and around there where we maybe need to open up and think a little bit more carefully about how things affect us and how we communicate with other people.
I think as well, it's a bit of a sort of drip effect as well. Angelina, it was before your time, but we have attended as speakers your road shows, and we sort of people, and I know Helen will reiterate this perhaps in a little bit more detail, that people will contact us with one problem, and it might be something relatively trivial, and then it will go on to be something else. Would you say that was right, Helen?
Yes, absolutely. One of the things that we look for, because we've been working within mental health for, well, I've been here 19 years. We've always done it. But you're quite right. Over the last few years, it's become much more prominent of working on. And you're also right. There is an age differential, without a doubt. So we will come to roadshows, we'll do work, you'll get very few questions other than maybe an employer asking, but then we will immediately get contacts within literally hours of people who don't want to open up them, which is good. And what we particularly looked at, because obviously our industry is male dominated, you know, there are women, I mean, I'm looking at them now, there are women within the industry, but it is definitely male dominated. So I think the thing about us is obviously we know the industry, all of us, and we look at it and we're working more and more towards additional support. So one of the things that we have is called Together All, which is our online mental health wellbeing tool that anybody can access within the industry. You don't even have to come to us. You can just go online and access it. And that is completely confidential and free to everybody. It's 24/7. And it's every day of the year. So a lot of people have been using that. There's lots of courses on there, there's chats. So if people don't want to talk to somebody at work, I think I'm not saying anything negative about any companies, but just some people feel that they don't want to divulge at work. especially at the moment with job insecurity. We're noticing that perhaps more. They don't want to put their head above the parapet. So here they can still get support, obviously, if they know that we exist. And then what we enable to do also is that we look at what's causing the stress and anxiety, because it's that emotional health. And I think everybody has it at the moment. I think, Angelina, it was you that said, you know, COVID, everybody's thinking about it in one way or another. But the key things for emotional stress and emotional health is finances, work, relationships, and health. And that's life, isn't it? So here at Perennial, we not only support with health, we also support to actually identify what those issues are that are causing the anxiety, stress. And then we work with that person and work on a plan to actually start working towards reducing it and getting the presenting issue actually under control. So allowing that person to feel back in control, that's the key thing when you're feeling stressed and anxious. It's because you're not in control of whatever it is, aren't you? Do you know what I mean? It's like, you know, it could be that you're anxious because you absolutely hate putting a mask on when you have to go out. It might be that you're feeling anxious and stressed because you've taken a reduction in pay at work and now you're worrying about paying the bills. So it can be lots of different things, and that's what we're here to support. But we particularly went for Together All because it works with the forces. A lot of the forces charities use it. It's very much male focused. So there's nothing, my brother, who is a landscaper, I got him to go on and have a nosy for me, and he's very blunt. And he told me it was great. There was none of that fluffy, frilly stuff I thought there was going to be. It was very much, you can offload if you want. You can just look at the chats and actually look at it and think, do you know what? It isn't only me who feels like this. You all work with somebody who's feeling stressed and anxious. Everybody else seems to be managing. So we're here to work with people the whole way through, but a lot of people want to keep it very private, don't they? And that's why it's completely confidential with us. I'll shut up.
And I think as partnerships manager for Perennial, I go out and I'm the sort of interface, as it were, with a lot of our companies and a lot of our supporters. And we work with some absolutely amazing employers, and they sort of say, when I talk about Together All, they sort of say in our services, they say, oh, well, our employees don't need this, that and the other because we've got these things in place for them. And that's very, very common, particularly some of the larger organisations that have, you know, big HR departments and lots of staff to look after. And what we say is ours is totally independent, it's totally confidential. And with my brother is a landscaper and a very, very good employer. I might be a bit biased. And he said, oh, my staff would, you know, he contributes to Perennial, and says, oh, but my staff would never need you. And I said, you don't know as an employer. You don't know what your staff are feeling internally. And if they trust the systems internally that you have in place, our service is so confidential that I'm a manager for Perennial. I have no idea who is using it and not. I will never have access to that information. And that's totally sort of appropriate, as it were.
Yeah, I'd just really like to praise Helen and Kate there for what they've said. I think that's really good. And I think the anonymity with it all is really, really helpful. Obviously, we've talked about this age disparity between maybe older gentlemen not wanting to, because it's the social stigma was there from when they were young stuff. But I think that anonymity is really important for the first step for any age, really. The fact that they know they're not going to be judged and they can start to seek other opportunities. I'd really just like to praise sort of groups, especially aimed at men like Andy's Man Club and stuff like that, which are fantastic groups and have really sort of brought people together. But also, I'd just like to praise all these groups that are bringing people together and not just addressing the mental health causes, but actually forming bonds and actually moving forward the conversation in terms of destigmatization of it and sort of engaging people with therapies that are not the most conventional therapies, moving away from almost medication to thinking about yoga, mindfulness, sort of eco-therapies, stuff like that, which therapy is that if you'd asked my dad 20 years ago, would you like to do some yoga for your mental health? He'd have probably said quite a few explicits. And yeah, I think it's that almost that anonymity that allows the softening of people to actually engage with practices that they might not actually undertake themselves off their own back. And I think I'd just really like to praise them for doing stuff like that. So, yeah.
Yeah, I think we all massively agree with you there. So Angelina, would you be able to talk a bit about how you at Ground Control engage your staff with mental health?
Absolutely, gosh. So brilliant, Owen, to talk about not just looking at medication, not just looking at, counselling alone and medication, fantastic, but you need support. And we do that via an array of initiatives across the business. And remember that not everybody wants to join a group. One size doesn't fit all, and it's about being able to adapt as a business, continually look at what's out there. Every day there is a new, therapy, but a new way of working, new initiatives. So you can learn a lot from each other, for sure. I suppose from my point of view, if we look at the way in which we manage the knowledge base of this, so we obviously run a lot of e-learning. We have a SLT, so a senior leadership team within the business. So we, the execs, will discuss lots of business critical information that can make people quite nervous. So let's say it's information about furlough, or because it's been complicated. Let's not beat around the bush. And I'm in awe of my fellow colleagues that have digested all of that information, condensed it, and sent it back out to those guys that could find it very anxious to work out whether can I work, can I not work, what do I do, how do I get back to work. So you've got to look at all of the needs of a person and know that they're not the same thing's not going to fit everybody. Engagement surveys are really important. So it's not about being reactive with health and safety. You've got to be proactive. So how are you engaging with your teams, your colleagues? Is it the right? You may think you're doing the best job in the world by doing a survey or running this course. As you were saying, it becomes a bit of a tick box for some people. But actually, is it what the end user really wants or needs? So do they need a 24-hour line available? Do they need access to a GP? And I'll kind of go through a little list of things that we've implemented. So yes, fantastic that we've supported yoga and the use of gyms when they were open. We provided free gym membership and discounts in other gyms that were not as accessible. We do have an in-house counsellor, as I was saying, and that's also extended out to those on furlough. Let's not forget that those people, and we did have a number who were placed on furlough, were feeling uneasy. Have I got a job to come back to? What does this mean for me? And regular consultation with those people is key. So if anybody is going through that at the moment, please keep communicating with your teams while they are at home or wherever, because they may well be feeling a bit nervous. NLP, tapping techniques, I'm an advocate of that. I love a bit of tapping. Emotional frequency techniques, please have a Google of that. It's fantastic. And if you do we have had cases where people have been off due to mental health, illnesses, but being unwell, not quite themselves. We also have the return to work counselling. It's really important that when someone comes back to work, that they may find that some of parts of their roles may be challenging, or they may not want to have a lot of face time with people. So it's about modifying tasks to suit. Online apps are the way forward. Of course, everybody's technical. Everyone's got the old iPhone or Samsung going on at the moment, and we have Babylon app. So it's access to a doctor 24/7. We had that from the first lockdown, because obviously everybody was panicking, making sure that they still had doctor's appointments to go to, and we made sure there was some consistency. And if you think about it, having a nice If you know where you're going and you feel calm, your life will follow that. And there's always the worry about what if I'm not here. So we also look at that element, life insurance. When somebody has a illness, terminal illness, what does that mean to them? Are they worrying about their loved ones? Are they worrying about? So again, that's something that we knew as a proactive measure. We looked at how life-changing circumstances can be for people. And the calendar today, just to share with you, we have a calendar for November, and I'll get that shared with you all. But today, it says connect with somebody from a different generation. That's quite poignant. And the reason why I say that is because we were literally just talking about, oh, it was always done this way, I'm tough, to the fact that we're a lot more open as a younger generation. So I'd urge you all, whether it's your dad, someone you don't know, have that chat, engage with them. I'd also say that when you're out and about, socially distanced walking, because that's as far as we can go at the moment, or running, that you don't know who you're walking past down the road. So it's not only your employees, it's people that are around you. We all need each other to operate as a world. So we want to provide great, safe working environments for people, of course, and we've still been able to keep some of those open for some people. It's about reaching out and saying a hello goes a long way to somebody. And looking at opportunity. So it's fight or flight at the moment for a lot of people. And it is looking at opportunities. So ground control are continually looking for some fantastic field teams. Get in contact with them, because at the end of the day, we're very fortunate to have had some real fantastic clients that have continued to deliver services. Of course, there have been some on hold due to hospitality industry, for example, but we are still continuing, and we want to keep building back Britain better, and we want to bring people on the journey with us. So we want people to know that we're here, and that you're a package, your health and your wealth, and your how you would work for us as a business. Absolutely.
Fantastic, thank you. I wondered if Roger and Katie, you could talk about the kind of responses that you've had to implementing these policies and talking about mental health more. Has it been positive?
Can I say, just off track a little bit, but just
go for it.
In kind of response to some of the things that people have said. I think it's amazing, like, to see companies, especially like quite huge companies as well, who are implementing these kinds of things. I think Perennial are amazing, but the one thing I do want to say, like from a mental health perspective, is it is that thing about what Angelina said about being proactive rather than reactive. So it is all very well having mental health first aiders and counselling services and those kinds of things within your team, and I think those things are amazing and they're great and they're wonderful, and it's so important for your staff to know where they can get help and support. So we have a mental health policy, and every person has a copy of it, and on that, and I've actually posted these to our blog today as well as a result of this, because my worry is that there's people watching that want support and don't know where to get it. So you can go on our journal, and there is loads of information there about where you can get support. But it is also about prevention, and I think workplaces maybe need to work harder, not these ones, because these ones all sound amazing, but some workplaces need to work harder to prevent mental ill health as well, and work specifically, like when I was working as in therapy, so many people would come into therapy with a work-related issue, and this is where organisations like Perennial are amazing, because they do target some of the practical issues that underlie mental health problems. But I think workplaces need to think about things like job insecurity, things like work pressure, work-life balance, flexible working, conflicts at work, and kind of how they can make the working environment more holistic from a health perspective. And that's what we do in our own practice. And and also in terms of like the design work that we do when we do design for health, and I'm sure Owen is probably the same, that you know, a lot of the research that underpins what we do informs the design, which informs, you know, the spaces and the places that are being built in order for them to be healthier from the beginning, rather than reacting or trying to change or adapt, or just react to someone who comes to work and says, I'm not feeling well, because it's kind of trying to create a holistic environment that prevents that mental ill health in the first place. And I think that's really, really important. So I just wanted to kind of mention, because when Angelina said that about being proactive, I was like, yeah, that's exactly what we need to be doing. Does that make sense?
Yeah, no, it's completely true. Prevention is so key. Does anyone else want to touch upon prevention?
I was just going to
Owen.
say, it doesn't have to be serious. So it doesn't have to be all this big pressure. I need a meeting. It can be a touch base call. I have them regularly with my team. It could be that you do we're having a cup of tea moment, and you might just pick up or gauge that someone's not maybe speaking up as much that you would expect, something off key, and then you can then take it from there. So don't feel pressured that you've got to have a policy, a structure, because you've got to work with what you've got, first of all, within the right tools and resources, and it doesn't cost anything to be kind, right? That's the most important thing. Kindness can go such a long way. Courage and kindness even more so. So that's what I would say, is don't pressure yourselves, relax. That's when you'll create the right environment. I've got to say, from our directors down, you know, CEO down, they've allowed us to be able to relax enough to be able to speak out, and that's so key. That's proactive.
Yeah, I'd agree with that completely, actually, and endorse what Angelina and Katie have mentioned. We've experienced a very similar thing, really, where from a point of view of actually being proactive as a mental health first aider, and as the policies we have as a company, they're in place to deal with situations that get to a certain point. But actually what we want to do is try to avoid as many people as possible getting to that point. And it comes back to this idea of coping mechanisms. Everyone has a bad day. Everyone falls out with the partner at home, or the kids drive you mad and you've got to drive to work, and everyone's been there. And it's about how you deal with that. And if when you're coming to work, you're adding to those pressures, it can actually have a real knock-on effect. So we talk about cultural and changing behaviours. That can be really, really simple things. It can just be asking someone, are you okay? It can just be saying hello to someone in the morning with a smile on the face, engaging with people, leading from the front, and doing the sort of things that actually encourage other people to follow that behaviour. Before we had lockdown, and that's been a real game changer, a massive game changer. Within the workplace, we had a breakout room where there was a table tennis, a pool table, a dartboard, a sofa, incredibly well populated by people, just to be able to go and get away from it, have a break, have your lunch in there. You know, as a company, we were famous for our nights out, and our bus would turn up on an afternoon and we'd all down tools, go on a little pub crawl around the local villages. Things that actually allow people within the business to de-stress, to relax, and to get away from that. Clearly, we can't do any of that at the moment. And we are actually, something we are working really hard on, is how do we adapt to the fact that our office looks very different. The breakout room's gone because we've had to spread more and more people out. We need the office space. We've got people sat in protected little containers now within the office. So, you know, that then reduces the amount of physical connectivity you have with people. We've got people working from home. So we have WhatsApp group for the whole company. So anyone who has either been on furlough or has been at home is still in touch with everything that's going on. People who are working from home or who have been on furlough, we try to make a point of keeping in contact with them on a weekly basis, just to check in and see how you're doing. But we need to do that on a day-to-day basis more across the business. And even in things like one-to-ones, which have traditionally been a very corporate affair, you know, this is where we're going, introducing just a well-being element of it. And that can be as simple as, how are you? How are things going? And anything we can, you know, anything we can do to help you. It doesn't always have to be about business. And I think that can have a really positive effect on the culture and help to speed up that change, really.
And I'd just say we've also been working quite actively with a lot of our partners and a lot of the trade associations, discussing anxiety and stress, but actually noticing the signals. which perhaps you wouldn't do before, how to be kind, how to say good morning because you don't know what's going on in the other person's world, how to ask open questions, give complete time to that person. So if you are having a chat, doing a one-to-one, turn your phone off. Don't be looking at your phone or the email that's popped up if you're doing it by Zoom or Teams or however you're doing it. And just being able to pick up those symptoms, just, you know, being able to notice those signals that people are doing. And some of them people just won't notice, but we've had some really good feedback, and it's been very interactive of what to notice, what to pick up on. And it can be just as Roger said, somebody's had a really bad day, and for whatever reason, something's gone on at home, your teenage kids are driving you mad, or it might be something completely different. It could be that that person really is getting quite stressed and anxious, because for some people, furlough was amazing, you know, but for other people, it was, you know, they lived by themselves and actually their social life was work. So now that's all gone. It might be that they were already just about managing financially and then they're on a 20% pay cut. We don't know, do we? We just don't know. They could be worried about the care of their elderly mother. So it's being kind, being open, asking open questions, how you look. Don't sit there with your arms folded, which I know I've got a terrible habit of doing just naturally. We've been doing lots of work on that and the tips and hints. And then if they do open up, how to react and where to go for support. Obviously, we're at the top of the list, but if it's more serious than that, of actually how to access and what to do.
And I think what's...
Go on, Kate, you go first.
Sorry, what's interesting from our perspective is that very quickly into furlough, we realised calls to our helpline were up by 400% in the first 2 weeks. So demand for our services. Now, not all of that was mental health, initially mental health things, that there were lots of practical concerns that people had. But we reacted very quickly, and I'm incredibly proud of my colleagues and our SLT of the way we have adapted so quickly to support the industry. And Helen and I and my colleague Phil Swainson have been working very closely, as Helen mentioned, with our corporate partners and with the trade associations. So Barley, the APL, the Landscape Institute, the SGD, and various other ones. But obviously we're at FutureScape today, so we'll talk about the industry specific ones. And the demand, and we said, you know, let's get, Helen will come out and she will talk to people firsthand about, you know, Helen's got a huge amount of experience. What was very interesting is that one of the biggest, most popular courses that organisations asked us to discuss, or subjects, was, as Helen alluded to, signs of stress. And it's this old thing, it's not me, I'm phoning for a friend. And it was that kind of thing. Again, I'm sorry, fellas, I don't mean to be sexist, but particularly the fellas. So there were things, and sometimes just even in terms of mental health, some people, I don't like talking, and Helen and I were talking about this earlier on, I don't like talking about mental health. I think it's just health we need to talk about. We know that they're inextricably linked, and I think if you take away the mental health side, it automatically drops a bit of the stigma as well. But there is, as several of you have alluded to, there is still a bit of a stigma and a generational thing as well. But when people know there's an opportunity to watch for signs in colleagues, watch their friends and look out for stress, they are far more interested in the course. Helen, would you say we were delivering the same course pretty much?
Yeah. We've done this so seriously. We've done it a lot. We've added, we tweak it to everybody who
yes, it's bespoke.
For, you know, we make it completely pertinent. Well, we hope we do. That's what we aim to do. And it's just, it's getting that information over there in an easy to use way, being able to pick up those signs, But we do it as if, well, this is for your employees, this is for your colleagues, this is for you to identify signs, but don't forget about your friends and your family. And in all honesty, we're really aiming it at them. So there'll be odd key little bits which will slip in. You may have felt like this. So I'll talk about stress at work, you know, stress in the workplace. Kate says at the beginning of COVID, I also, one of my joys is I also, you know, keep an eye on the helpline. We literally went from one person on to having to have 6 people on because the increase went up so much. And most of it was about what's furlough, how do I have, I'm self-employed, what do I do? So we were having to keep up with all the government stuff, and people just, it was just getting that information together, making it bespoke for that individual and getting it out. And you could hear that change in voice from highly stressed, what the heck am I going to do, to just feeling, I know what's happening. And it's that being in control. So we've been doing all sorts, absolutely all sorts, but we want to do more.
Just sticking with signs, I mean, let's not forget that there's an illusion. There's the illusionist amongst us all. If we think of Robin Williams, he just came to my mind as we were talking today. So the happiest person can be the saddest person inside. So it's again picking up on other areas. So when I was looking at in social media, of course, for the younger generation, life always looks perfect online. And loneliness, you can have lots of friends online, but be very lonely. So it's about acknowledging that and other signs. So if I swing on put my cap on in terms of a safety professional, incidents, accidents, as somebody, you know, driving, knocked into the back of somebody, or have they had 2 incidents in a very short period of time? What's typically incidents occur because loss of concentration. Some can be a violation of a safety requirement, of course, or something like that. Or did they not have they forgot to pick up the right tool to do the job? So they've got to get it done. I'm going to do it this way, and bang, something happens. So it is about that kind of behavior. It's about, you know, I can tell myself when I go in, when I've had a very busy time, and we have with providing lots of documentation for COVID risk assessments. So that's really important for you guys to make sure that you've got in place. When you've got all of those that you're producing, various documents communicating, to come unprepared to a meeting, I could be in a fluster. Now, if that was just me in a fluster because I've not had a chance to prepare because I'm busy, if I was out there on the tools, would that mind distraction in my mind cause me to make a mistake? So what you must do is not just look at, you know, maybe a sad face, or it's not just the telephone call. Some people don't have the chance to get to that point. I don't think Robin Williams did. So it is about looking at the whole person. Have they got anyone that needs them? You know, are they living alone? Have they got are they having to shop for like 5 people in their family? We flexed our time. So the cons from us was, at the very beginning of lockdown, was if you've got family that you need to go and buy food for, or, you know, as we know, there was this craziness, you couldn't get hold of pasta and toilet rolls. You know, if you need to go and get that, take the time out of your day, go and do that, and you will receive so much back, much more back from your employees who value, that will no doubt go above and beyond like we do, because we care. So I think that's, for me, it's just so important. And awards, so reward people that are demonstrating elements of kindness, reward those people that are recognised in the business. We do this every year. I'm delighted. I was just on the panel this week looking at all of our winners. You know, it hasn't got, you know, we can do this remotely now. Fantastic, we've got technology. But, you know, who is the most helpful person? You haven't got an award because you've smashed a target, let's say. It's about what value have you brought to the business. And if that's just yourself, then you're halfway there.
I'd just like to say that I think it's great how everyone's described such active policies, because I think it's too often that you go to some companies and they've got the accreditation from maybe mental health at work or investors in people, and it's literally on your first day you're given this sort of slab of pages, and you've said, there's our policies on this, that and the other, and by the way, you might get 5 mental health days a year or something like that, but you're never reminded of it again, and you almost feel like it's been put to a side for a reason, and that there's a reasoning why people aren't mentioning it. Is that because it's frowned upon to actually take them? But There's other things that companies can do as well as be active. And like Angelina said, it is about rewarding. It's about giving people the opportunity to actually develop personally and professionally as well. So whether that be funding someone to go for chartership in terms of landscape architecture, or potentially if they're a contractor and they're showing a real sort of talent. Obviously, roller training, etc., is all standard practice anywhere, but maybe it's recognising these people and saying, well, they're showing such a talent and interest into the plants that they're interacting with every day. Why don't we put them on a horticulture sort of course if that's what they want to do, or really just giving people options to zig and zag instead of just seeing it as work as this one linear career, and really help people to engage and sort of be the best they can, really.
Yeah, absolutely. Kate and Helen, excuse me. I wonder if you could talk to us about perhaps an example of how you've helped a company in the past who've come to you for help in sort of helping their staff's mental health.
Well, during, I mean, obviously we've been around a long time. I've lost track how long, 182 years. We've really changed a lot since 2001. We've really moved on leaps and bounds since then, very proactively. And we were already moving and doing changes before COVID started. We've just moved things around in the order that we were doing them. So what we've been particularly working on since the beginning of COVID is going out to obviously the trade associations, the partners who work with Perennial, but in all honesty, anybody in the industry. You don't have to be a partner to get support from us. So we are available to everybody. You don't have to work for somebody else. We have a predominantly large amount of people who are self-employed. It's approximately 25%. So we're just available for everybody. It doesn't matter what you do within the industry, we're here. And what we've been looking at and working very much towards pre-COVID is prevent, so support and prevent. So everything basically, that's what we're attempting to do. So from COVID, we were putting out there very much that we are available. We've got lots of new prevent measures. So on our pages, we keep it completely updated with all the new COVID information from the government. That's every time there's a new announcement, the email pops up in my inbox and I disseminate it down and we get it on the website. We've got other prevent issues like money matters with budgeting tools, money diaries, top tips. So what we've done is we've drawn that together, gone out to the partners, when I'm saying me, Kate has, and offered. So, but the main one that has come back is about, because of COVID predominantly, is the staff's well-being. Now, for every single trade association that we've done, or every single employer or company, it's obviously based on what they've asked for. Sometimes, obviously, they don't know everything that we do. So we try, we explain a bit more so we can put a bit more meat on the bones. So we've been doing lots of work, as I say, about looking after your staff, how to identify, as I said before, the signs, but then what the solutions are, how to talk, how to move forward, and really building not just that prevent, but being proactive going forward. Because yes, COVID has hit everybody, absolutely everybody, but if you were already perhaps struggling at work because maybe you'd got to that certain age, which, like me, you've got to that certain age and maybe you're an ab and it's just all becoming a bit too physical, what do you do? And you can, we have had people come and, you know, their income's going down because it's physical and they just can't do quite as many jobs. So what do they do? So we're working with them. So it might be financially, you know, immediately because they've got a bit behind or starting to struggle, but then we'll look at what they need, and it might be that they need physio support and actually it's not as bad as they thought, or it might be, do you know what, let's give you some employment support and actually look at retraining and move you forward that way. We've had a brilliant result this morning of somebody who went through that. We've just found out that she got the employment support and she's just been appointed with a brand new job, and there was over 4,000 other people that actually put in for it. So that's really good. So the seminars that we've been producing is, as I said, bespoke on the whatever they want. most of it leads into Together All because it's a tool that everybody can use, and a lot of it on there has got the courses on there. Lots of different courses that people can either work with somebody else in groups on there, totally anonymous, as I said, or they can work all by themselves. How to Stop Procrastinating is one of the ones that is downloaded the most. How to Sleep Better is downloaded the most. How to Improve Your Self-Esteem. So we're all working on that. A brilliant example of it, I'll leave to Kate to explain.
What, in terms of working with partners?
Yeah.
Yeah. One of our partners, I'm very biased because I love and treasure and value all of our partners. One of our partners that have been with us for about 18 months now is the Tivoli Group. And we work very much on the basis, and my background is a very commercial background, so we work very much on the basis that we're there to complement employers, not compensate for what they lack. So people say, can you do X, Y, and Z? And it's, well, actually, that's your responsibility. And I don't mean to be hard-nosed about it, but we have a joint duty of care for people that are employed and working for the, you know, within the industry, whichever strand or sector that might be. But we would, you know, we have fabulous support from Tivoli, and they asked us, we were talking about different seminars. And again, it's a good example of somebody that has really good welfare and really care about their teams and see the value of their teams. But it's this thing about people sometimes feel more confident talking to strangers, or it's useful having a different set of eyes and ears. So we've rolled out, we had an initial meeting with the board, and it happened so quickly. Had a board meeting, Helen and I were trying to work out the exact timings, but within a couple of weeks after talking to our initial points of contact, we have then rolled out a series of programmes that Helen's running with different parts of the services team to the benefit of their employees. And then in turn, there's talk of whether they need to disseminate the information themselves or whether we come back and do the next tranche down, as it were. And the feedback has been really, really good. And it's a win-win situation. And it's this whole thing of we are there almost cradle to grave, because we look after not only the people working within the industry, but also their dependent families as well. And it's this whole joint duty of care. We've got joint duty of care for your staff now, but we will look after them into retirement. And I can't remember, how old is our oldest service user now, Helen?
103.
Yeah. So
what we do from apprentices, you know, you've
yeah.
just got to be working in the industry or have work, be off sick, retired, whatever. So, you know, so the age range, but it is that family context as well. So you all do amazing things with your employees. What I would say to you is, obviously, there are some solutions you can support them with. So, you know, being able to get outside, being able to take the time off to do things. But if their issue is something else that actually they need support with, whether that is because they're caring for somebody, or they have got financial issues, or relationship problems, housing problems, you know, life, let's be honest, life comes along and bites you, doesn't it? And then you've got COVID on top. The thing is that then we can provide that bit, all that support, but then if they come through to us, we can actually then start moving with that plan and get those issues actually sorted as well. And so we don't like to think, we don't want to be the sticking plaster. There's no point just dealing with that tiny bit that's the issue on that day. When I'm training the team, I'll go, you know, people will present with an issue. Think of it as an iceberg. It might actually be that one little issue and it's just a chip floating on the top, but actually more than likely, it's a humongous iceberg underneath. So what are the actual issues? Let's make a plan, let's assess it, let's prioritize, and then we work through it. So actually, we work with that person, it's their plan, bespoke to them, so we have an ultimate solution, like the lady who's just got a fantastic new job. you know, like the person who's been homeless because they lived in tied accommodation or it was with work and they were sleeping in a doorway, now got their own property, got income, and is now back retraining. They're the, you know, they are crises, but for other people it is, I'm self-employed, I don't know how the heck to claim this new grant. Well, how do I do that? So it's very varied. We're here for everything, but as I say, we like to look at it as a long-term solution, if as and when required.
Brilliant. Owen, I wondered if, and I'm sure Katie will be able to weigh in on this as well, but Owen especially, I wondered if you'd be able to talk a bit about how mental health support can sort of go beyond the workplace and into the environment and sort of the public realm. And I know you've got a fantastic company to talk about as well, so I'd love to hear about that.
Yeah, so as a lot of people have said, really, it's about really recognising that policy shouldn't stop at the door of the company. It should go beyond that. And obviously, as Katie at Studio 31 said, a lot of their policies blend the outside with the inside, and it's something that we do within landscape all the time in terms of our design. But why isn't lifestyle quite like that, and why isn't the working lifestyle quite like that? And obviously, one really good way to promote the use of the public realm and positivity outside of business is actually to give good active travel towards work. So are you promoting sort of cycle to work schemes? Are you promoting walking to work, running to work? Sort of obviously this might mean that there's some amendments to make to the office. So maybe you have to install a shower or they have to do this. But what research has found is that people that walk and cycle, run to work are happier, and a happier workforce is a more productive workforce. And it's just beneficial for companies, as you said, sort of if everyone's there and they're happy, then it's beneficial for both the environment and the profitability of the company. But obviously, we're not always just walking and cycling to work. Obviously, time at work is really important, and implementation of sort of opportunities to move away from a desk, walk around outside, sort of implement sort of the opportunities to promote mindfulness, etc., are all really good. But if we're interacting as a company with wellness and the environment in terms of one aspect of commuting to work, why can't we do this again during the work? As Katie at Studio 31 has obviously said, a lot of her meetings can actually be in local cafes, outside, walking meetings. These are all excellent. And sort of if you're promoting cycling, walking to work, you might now have a redundant car park or a few redundant car park spaces. Why can't this be a pocket park within your development? Obviously, everyone knows the benefits of plants to well-being, but what you've got to remember is you're not just creating that pocket park or piece of green space for your company in that aspect. You're then actually creating green space for people that live in the area as well, because obviously we have to recognise that cities and our lifestyles are becoming more urbanised. Obviously, as urbanisation grows, we need to implement more green space within the urban environment. And I think that's a big thing, is that a lot of people don't have the contact with nature that maybe commuting from a suburban or rural setting into an urban setting used to have. A lot of people are living where they work, and even though that's excellent to have this half-an-hour walk or cycle to work, and that will make you happier, you still do need, as a human being, to fulfill this biophilic need within you. I'd be amazed to see what the survey results from such a survey with the ground control sort of operatives that actually handle plants every day would say. They must be the happiest people in the world to a certain extent. But it's really about recognising that, yeah, the office can be really good internally, but it should also be benefiting outside as well. Obviously, a lot of people are using social value calculators at the moment to try and see how their company is valuing the local environment in local communities and stuff. Well, why not get out and actually be interactive with the local community? Like I said, these opportunities do exist, and it shouldn't stop at the front door. I think also, just talking about plants, actually, I'd like to mention during lockdown, obviously there was there was quite a few plants disposed of, and we ourselves at Headplace actually started a campaign to save these plants that were being disposed of within the first lockdown. Obviously, this lockdown, garden centres and the like have not been closed down to a certain extent, but we were rescuing plants to actually distribute to people that were self-isolating or had such a distance to travel to green space that it was unviable for physical, financial reasons, etc. And obviously what that actually really highlighted to us is this is an element that goes beyond COVID, really. There's so many people that have a disadvantage in terms of environmental needs, etc., that it's incredible, and we're really sort of promoting that. And as I say, it's about being able to benefit others by supporting schemes like that, or by recognising that you can help people outside of work, and your employees at the end of the day are only as good as they feel, basically.
I think going from Owen's comment about employees only as good as you feel, I remember a comment from a landscaper, again, another partner, medium-sized but high-end, and he said, why wouldn't you support Perennial? He had or has a member of staff that had a partner with very poor mental health, and he said, I didn't know. He said, he's only told me recently, but Perennial were absolutely brilliant. He said, I've been talking to you, but I didn't realise that he had been talking to services team. And his comment was, why wouldn't you support somebody that supports your staff? And he said, and the wife, and it was a good example of, it's not just your employees or yourselves, it's your families as well that can affect your mental health, and I think that's sort of critical to. We tend to think of things as being work related all the time, but there can be the oddest thing that upsets people. You know, Helen mentioned putting on the mask. I find I'm a very laid back, quite blessed person in terms of stress levels. Putting on a mask freaks me out. but joking aside, I can feel myself getting upset when I'm putting it on.
Yeah, I actually think that's a really good point, because as well as all those additional pressures that people have got outside of work at the moment, many of our normal coping mechanisms, the things that we would do to relieve our stress, be it going and socializing, going and playing golf or tennis or whatever it happens to be, those sort of things are very hard for people to do now. So you've got all of the extra pressures outside of work, what's going on inside of work, the worries of this, the worries of that, and far less opportunities to actually allow yourself to deal with it. So it's something that we need to be much more aware of.
Sorry, Kate, go on.
I was talking to a garden designer a while back, and absolutely lovely, very laid back woman, really, really nice. And she said, do you know what? The worst thing about all this is I miss the hugs. And I thought, it's the physical contact with, occasionally, I had a meeting, we've been working very virtually, and I had a meeting with my partner in crime, Phil Swainson, and my boss, who's our head of marketing and fundraising. And it was so lovely to see them physically. We talk every day via Zoom. I mean, we maintained all our social distancing and everything, but it was still that you'd naturally see your colleagues that you get on with, and you'd naturally want to give them a hug or shake hands, and that does have impacts on people's mental health as well.
I also think Roger's correct. When you'd finish work pre-COVID, maybe on a Friday night, you might go for a drink with colleagues, you might go out with friends, you might have a game of golf, you might go running, whatever you would do. That is all now, all those ways that you got to actually relax, take it out of your mind, that's kind of gone now, hasn't it? You can go out for a walk with a friend. I mean, you know, but it's not quite the same because, you know, you've got to be distant, you've got to be whatever. You can at the moment go for a game of golf, you can walk around the golf course, but you can't have a game of golf. But it's those things that you naturally do that even if you aren't consciously thinking it, it's what you do to chill out, to actually get it all out of your brain, relax. And we're not doing that at the moment. And a lot of people are actually also working from home. So I don't know about you, but you probably, whereas before you were thinking, oh, I'll get finished now and get off. You're thinking, well, you don't have to go anywhere, do you? So you work that bit later because you're going to just finish it. So it's that emotional disconnect you just can't always achieve at the moment. And I think that's for everybody.
I think that's a really important point, and something that I've been definitely doing is actually the fake commute in the morning. Even though I'm work from home, I'll take the dogs out for sort of a half an hour walk around the local park. Obviously, again, sort of greenwashing it a little bit by going into the park and trying to achieve my 2 hours a week surrounded by nature. But it's really one of those that you have to start setting boundaries. And again, it's maybe a different type of policy to what you have at work in terms of well-being, but again, it's allowing them opportunities to break away from the desk and really engage with something that people might be a bit more interested in. Maybe even breaking the day up in terms of, I know I worked for landscape companies that they have a daily Zoom meeting just to check in, just to have a progress, just to have a conversation. Obviously, loneliness is a terrible infliction, really, and one fact that everyone really loves to say is that loneliness is as bad as smoking 15 cigarettes a day. It really is quite impactful, and again, social distancing is having a bit of a problem, but it doesn't mean we can't meet up outside and enjoy nature, surround ourselves with nature, green spaces, blue spaces, etc. And really, this is the time to start thinking about, well, everything's a bit slower, a bit emptier. What can we do to change things in order to make things better? Is that engaging to redesign the office? Is that engaging to redesign local space? Are we thinking about moving cars out? I mean, best things that could be done really now are community planting schemes. I mean, as an industry, we have per square metre written on all our drawings of planting schemes anyway. Surely that is completely applicable for social distancing and COVID rule. If someone just takes all all that square meterage and that square meter, you're never going to bump into each other. And yeah, why not take this sort of emptiness and distance as a positive, really, and still meet up with people, but really take this quietness as a positive and a bit of a pause to really make an impact.
Sorry, I think Angelina's been waiting to speak for a little bit, so I'm going to let her go for it.
No, sorry. So I think just listening to all the different conversations, you can see me jotting down because there's such good points. In terms of, if I just stick with the outdoor piece, Owen, it's really important, you're quite right. And sometimes I forget to open the door and take a few deep breaths, because you're then in front of the computer, you're involved, you've got conf calls, you've got Zoom calls, you don't want to Zoom in the evening with your friends because you've had enough during the day, but it's having that 2 minutes. And it goes back to mindfulness, just being aware. I mean, the leaves turning now, beautiful colours out there that we probably don't even notice, right? We don't notice unless we've got something stuck on our shoe that we've walked back in through the door. But in terms of ground control, we're doing quite a few things and we're pushing on with that. So I don't know if you guys know about our Evergreen Fund. So we have 5% of our net profits going into, putting back into environmental initiatives. So we've got some goals, 1 million trees by 2025 that we want to plant, and we've already been really successful in starting that project. And we went out to the NHS. Obviously, we had Nightingale being built, and we had a fantastic team that took the initiative in the business to create. We know the pressures that the NHS are under at the moment. And in fact, I was only walking last night, walking the dog. Again, animals, amazing therapy. But walking the dog, and I was thinking, we did the clapping and we did all of that, and yet the NHS is still continuing, and we've the posters aren't up and the windows as much and that sort of thing. But we really wanted to create something that would leave a legacy. So we created some open spaces for those people, our critical and key workers that are saving lives to go out. We were talking about the masks, Kate, just going to a supermarket, we're feeling a bit freaked out. Could you imagine doing a 16-hour shift? I know I've been a bit sweaty myself. So for them to go out and just have that time out, to sit there, gather themselves, many, as we know, we've lost lots of lives to this, they would have been going through an awful lot of mental health strains themselves, so it was really key for us to put back in. And that includes the initiatives like biodiversity days, bee stops. That's another thing that I feel was fantastic. I love a bumblebee. And also, I suppose the other element of that would be, thinking about how we utilise our giving back days. So we entitle our teams and our employees to give back 2 days paid per annum. So we've got an awful lot of headcount there, where we can go and look at initiatives and work with people. So whether that's tree planting, it could be an array of things. So we've got to keep sight of that for sure when we're looking at trying to clear the mind, as one would say, and being proactive. And then the other side of that I was then picking up about what we're still doing around mental health is being aware of things like medication. So we've already said it's a taboo to talk about mental health. When you go down to the next line, which means that you're potentially seeing your GP and you start either therapy or medication, it's about making sure that you're safe operating within that working environment. And as managers, you need to be aware, and business owners, you need to be aware, because you may wake up, like I said to you, you could have an incident because your mind's busy, or you could have started some new medication, driving to work, and you have an accident. Now, you come off all right, but the person in the other vehicle has had an impact, and that could be the same as working with your colleague, and they have an accident as a result of maybe not being fit for work or something like that. So it's really important as employers that you understand that, and being kind to yourself. So I know I can be hard on myself about maybe even writing down what you have done well during COVID. And if it's just surviving lockdown, you've done a good thing. What have you done? You've clearly, all of you on the call today, and I'm sure out there on the wider group, have helped somebody or had a conversation or supported someone during these difficult times, let alone normality. And to have a look at things like podcasts. So we've launched the Calm app across the business. If you think about it, you do get one life and you learn, right? And these podcasts, a lot of them are free out there. You have the ability to learn. And do you know what? You don't have to sit there talking about mental health on a podcast, because that can be a bit much if you're not feeling in a great place. If you like golf or cricket, listen to a podcast about Tiger Woods. Might make you laugh. You could put some stand-up comedy on a podcast, because laughter is also a cure. So I'd urge you to get together in forums such as this today and try and, embrace the odd joke. I've got one of my guys that on our team meetings, we have a couple a week, he gets his harmonica out, and I love it because it just makes everybody smile. And he would do a quote of the day. So, it is hard at the moment. Christmas is coming. You're going to have people that are going to be at home alone over Christmas. Check in, it's a struggle. If you look at all of the Samaritans and all that sort of thing, that the telephone lines normally peak around the Christmas period in normal situations. So we're going to go into that season right now where we're going to go down that road. So again, that's just another thing to be aware of.
Okay, fantastic. I thought we're kind of coming to the end now, so I'm going to try and wrap up a little bit, because I can see we've already got one question submitted. But my last question, I was just going to end by getting each of you to just offer one piece of advice to a company that might be watching, or maybe just an individual that's watching and is struggling with their mental health. Just a piece of advice. Should we start with Katie? Are you on the spot? Oh, you're muted.
Unmute. Okay. Just one is really, really hard. For companies, I would say you need to find a way to be comfortable talking about mental health, explicitly talking about mental health. It's amazing how many people are really, really uncomfortable with talking about suicide and feel that if you mention suicide, it's going to make people suicidal, which is just not true. And I think a lot of people are really, really uncomfortable being explicit and talking explicitly about mental health. And if you implement a policy like you can have a mental health sick day, don't then sit in someone's one-to-one and go, oh, you had a mental health sick day this year, so I'm pretty sure you wouldn't be up for that promotion. You've got to find a way to overcome it. And that comes from an internal space, training, education, knowledge. From a personal perspective, if you are an individual watching this, my one piece of advice to you would be ask for help. Like, it's the hardest thing in the world to do. And I've written this blog specifically for this reason, because it's so hard. Like, just go on our website and read it if you do nothing else. But you are not alone. Like, there are so many people who feel the way that you feel. If you feel that way, just ask for help. And I think it's probably worth at this point just mentioning somewhere like the Samaritans. So if you are watching today and you do feel like you need to ask for help, Samaritans number is 116123. And you can also email them and all sorts as well, just so that if anyone is watching and they do feel like they need support, they know where to get it. So yeah, I would just say ask for help, because you're not alone. And there's so many people out there. And if you do ask for help, you'll find out that you're not alone.
Fantastic. Roger, did you want to?
Yeah, I think like Katie, keeping it to one thing is quite a challenge. But I think from a company point of view, one of the things that I've learned from speaking to different businesses and from doing my own research is just be authentic. If you're going to do this, do it for the right reasons. If it's just a question of ticking boxes, then people will see through that. If we want to change cultures, we want to change behaviours, and we want to open this up to become a real debate and a real discussion and make people feel comfortable about it, then be authentic, and I think we've got more chance of actually doing that.
Owen, did you want to go next?
Yeah, I think obviously I agree with both points what's been said. From a company point of view, I'd say educate yourself, create a really solid basis, and then you can see which directions you want to go after that. There's not one correct answer. And again, as an individual, the best thing you can do is educate yourself, obviously, but is to talk. And especially if you're in crisis, obviously, as Katie said, the Samaritan's always there, but for the younger generations that don't really like phone calls, maybe texting's more your thing, you can text shout to 85258 at any point, and they're always there to help, really. And I think that anonymity, again, as I said, can be really beneficial. But yeah, education and talking, and then yeah, build that research knowledge.
Fantastic. And I don't want to rush you last three, but we've got about 5 minutes, and I want to squeeze in a couple more questions from the watchers. So yeah, Helen, did you want to quickly go?
Yeah, quickly, for firms, trade associations, we're the charity here to support you. If you want more information, what was just to say, we do bespoke seminars, we've got podcasts, we've got workshops. Just ask us, we're here to help. As an individual, if you're not ready to talk to somebody, we've got a helpline if you are, but if you're not, look on our website, so just perennial.org.uk. You can go on Together All. You don't have to ask anybody. You don't need any permission. You can just go on and use it. You've got quickly on there, you can say how you feel, but if you don't want to, you don't have to. But if you go on there and you're showing signs that you need more support, there's a mental health practitioner. We'll take you to one side and do it privately. But we've also got the contact details on there for if you need more support, as Samaritans, as Shout as well.
Perfect. Angelina?
Yes, the only thing I'd say for individuals is the only thing more exhausting than having a mental health illness or being not feeling yourself is pretending like you don't have a problem, because that can be exhausting. So be yourself, be open, be honest, and be kind to yourself. You know, acknowledge how you're feeling. If you don't feel it's the right time to talk, don't feel pressured. We're not expecting everybody to call today. You might feel like it in a week's time. So every step counts. So take a little step at a time. And for employers, by all means, reach out if you need to talk to us at any time. If there's any initiatives that we can share, I'll share some stuff with Rachael. And let's start getting proactive. Let's not wait to get the mental health first aiders. you know, on board. Let's try and keep our teams engaged, happy, healthy, and I think that'll pay for itself.
Fantastic. And just to say, you can request a meeting with any of the panelists today. You can send them messages. So if you do have questions that you'd rather just ask directly, then that there is the ability to do that. So just really quickly, one person was asking where they can find the blog, Katie.
Oh, what's the best way to?
I can pop in a link. It's just on your website, is it?
Yeah, so it's www.designstudio31.co.uk, and it's just in our journal. It's the first blog.
Cool, perfect. And then somebody else was just asking for advice on planting for clients who experience migraines regularly. Are there any plants or colours which can improve or worsen the effects of migraine? They're just thinking a lot of people might have been suffering with increased screen time over lockdown.
I mean, I don't know if Owen wants to take that, but for me, it wouldn't necessarily be about the specific plants. You know, obviously there's plant-based remedies and all those kinds of things, but it's more about the connection with nature. So there are, if you go out and you connect with nature in some way, that it is proven that it will improve not only your mental health, but also your physical health and your physical well-being. So reductions in heart rate, blood pressure, stress, anxiety, and very often migraines are associated with stress and tension, and nature generally, and connecting with nature generally is kind of associated with reducing those things and reducing stress, and therefore hopefully reducing migraines. In terms of actual specific plants, I'm not aware of any that specifically target that thing, and I don't know what you do. Like, would you stand specifically with that one thing? I think sensory stuff could also probably be a trigger. So if you greater influences or greater impacts if you are around water as well. So if you can be in a space with water, that's really good. And obviously in terms of sense of smell, you've got to be careful with migraines, because generally sensory gardens are really positive and have really positive impacts, but that's not the case for everyone. And if you're very olfactory sensitive, it may be that some sensory plants aren't right for you. But I don't know if Owen knows any more than I do on that.
I think that's a really good point to make, actually, is obviously anxiety is the sort of overburden of stimuli, basically. So olfactory senses being overwhelmed can cause anxieties in terms with visual and auditory, etc., etc. What I would say is some plants are better for mental health than other plants. Some plants are better at creating negative ions than other plants. Best thing you could do is research that. I'm not going to spew a few list stuff for you now, but yeah, research indoor plants, outdoor plants. And what I'd really say is think about sort of limiting your screen time. Now we're in the darker months, make sure you're getting out there, getting that natural light, because there's less of it. And obviously, if needs be, you can supplement that with artificial light, sort of full spectrum bulbs. We've just posted a piece about sort of seasonal affective disorder on our social media and stuff, so that's there. But yeah, I'd really say limit your screen time. Maybe even think about filters to go on your computer that can actually change it from blue to orange light, brightness of the screen, etc. But yeah, in terms of plants, do your research on different things. There's so much resource out there in terms of plants that are beneficial for mental health, and other things, productive plants, which can be really good because you get that hands-on thing, and it's just, yeah, do the research.
There are lots of plants which are beneficial for mental health. I'm not sure about migraines, though. I didn't know about that. The thing is about being outside is there's almost like pandemic levels. That's an awful word to use at the moment, isn't it? But of vitamin D deficiency because of people not accessing nature and not being outside in natural light. And that probably is something that Owen's talked about in his kind of seasonal affective blog as well. But you know, I would say the best thing you can do is just go and engage with nature generally, particularly trees, forests are really good as well.
Yeah, I think that's really important. And obviously, if you suffer from anxiety, OCD, sometimes just leaving that front door can be a real issue. But trust me, you'll feel so much better after you do, and you'll know that you're conquering these elements, and that you're really sort of not being defined by the mental health issues that you may have. But yeah, it's just really important to get outside as these dark months happen, and really start to look at exercise, overall health, diet, etc. There's not one silver bullet for improving mental health. It's a sort of a combination of many factors, and I think that's really important to really push. Is a lot of people that start to suffer from mental health illnesses almost think that there is one cure, or it could be a really quick trip back. Sometimes it can last quite a long time, sometimes it lasts forever, but it's really about like I say, arming yourself with the best knowledge possible, and do your research and really put yourself first. Don't compromise on yourself.
Fantastic. I think we've probably been cut off actually. It's all automatic, so I'm not sure, but thank you so much. If people can still see us, thank you so much for joining. And again, you can contact all of these people individually if you feel you need to. And yeah, thank you so much to all the panelists. It's been so interesting. I wish we had another 2 hours to talk about all of this. But yeah, thank you so much. I really appreciate it. It's such an important topic to discuss. So
thank you, Rachel.
Thank you for having us.
Thank you.
Thank you.
okay.
You've all given me great, again, reminding me of all the stuff that we do and can do better. And I really appreciate all your help, and it'd be great to connect in on LinkedIn or something. Let's keep sharing share the love.
Definitely.
Yeah.
All right, well, fantastic. Thank you so much, everyone. I'm sure I'll speak to you all very soon.
Rachel, will you be sharing that on like LinkedIn or something?
I'll talk to Jamie. I'll let you know.
Brilliant.
Yeah.
Thank you.
All right.
I'll just share it with the business. Thank you.
Yeah, perfect.
Bye.
All right. Thank you
Bye.
so much, everyone.
Bye.
Bye-bye.
Bye.
Bye.